Emergency room visits are costing you double what they did just 10 years ago. Prices now at an all-time high. Patients go in for life-saving treatment and come out with tens of thousands of dollars worth of bills. What's the astronomical cost of health care? ABC 7's Jess Dowdrick investigated. Jess.
Alan, when you're in an emergency situation, the last thing you're thinking about is how much it's going to cost you to go to the emergency room. Getting the help you need is and should be your focus. But be aware, when you're home recovering and that bill comes in the mail, you may just be shocked at how much this potentially life-saving visit will cost you.
I was shocked. I could not believe that for 3 days in the hospital that the bill would be that much.
One day, Bonnie Gottlieb noticed her feet were swelling, so she went to her internist, who immediately sent her to the emergency room.
I actually felt fine, didn't realize that a whole lot was going on.
Gottlieb drove herself to Sarasota Memorial Hospital. She was admitted and spent 3 days there. Gottlieb ended up having a heart ablation. She was released from the hospital on a Friday, and the bill she'd soon get was the furthest thing from her mind.
You just don't know what the cost is going to be until you get the bill in the mail.
When it came, she couldn't believe the high costs.
The total bill was almost $100,000, and I had to pay $114 and change.
Lucky for Gottlieb, her insurance company and Medicare covered 99.9% of the bill. Not everyone is so lucky. Prices for treatment at 7 Suncoast hospitals range drastically. According to the FloridaHealthFinder.gov, Manatee Memorial Hospital has the best rates in the area, averaging between $17,000 and $78,000 for a 4-day stay. At the other end of the spectrum, there's Englewood Community Hospital, which is reportedly the most expensive hospital to go to on the Suncoast. Their prices average from $38,000 to $97,000 for a 3-day stay. It doesn't matter which of these hospitals you go to, the bill won't be cheap.
The emergency room is the most expensive place to access care.
The question is, why?
They have to be ready for the worst case scenario, a gunshot wound or something where an airway needs to be opened or maintained.
Healthcare professionals say hospitals have a fixed cost in preparing for those types of situations and the equipment associated to treat those patients.
The tricky thing is that there's no transparency in what it actually costs the hospital to have that equipment.
So when someone comes into the emergency room for something simple like a fever that can be treated by a primary care facility, that actually drives up the cost.
Even though that it may not be life-threatening, the same people must take care of those people. So the people that come in for non-life-threatening bear an additional cost to do that because of the people and the place that that service is being provided.
Then there's the physicians that are treating you. Most of them are contracted. So while the hospital takes your insurance company, the doctors may not. Sarasota Memorial Hospital staff say there's no simple way to explain hospital billing. They said in a statement, quote, "It's a complex system that has evolved over several decades to adapt and comply with extensive government mandates and rules set by Medicare and Medicaid, as well as the ever-growing number of private insurers and health plans." The hospital went on to say that low-income patients who fall within 200% of federal poverty guidelines can receive free care, but that payment has to come from somewhere. So who fronts the bill for the uninsured or those who simply just don't pay their bills? According to USA Today, hospitals can try to compensate for those losses by charging other patients more. But they say it doesn't happen as often as you'd think. Instead, federal funding offsets some of those costs of treating the poor. Staff at Blake Medical Center in Manatee County simply cites that it's up to your insurance company what you pay. In a statement, they said, quote, "What our community pays for health care is dependent on each patient's type of medical coverage. We are committed to providing everyone with quality, cost-effective care. So maybe if you're lucky, like Bonnie Gottlieb, you'll come out of a 3-day stay with a $114 bill. But for most others, be prepared for a bill in the thousands."
I just consider myself very lucky that I have such good health insurance. And, you know, I would hope that other people would be as lucky as I am.
So how do you fight the rising healthcare costs? Unfortunately, there's not much you can really do. You can know which area hospitals take your insurance. That will help. And before you get any tests, treatments, or anything of the sort, ask how much they'll cost. Know what you're paying for. Also, avoid the emergency room at all costs. Use urgent care facilities or your local physicians when you can.
Jess, thank you.